So when you think about that LTV extension, patient lifetime value is decades, not months. It is years and years, almost irrespective of the clinical specialty. It is an extremely long-term journey. And oftentimes, I think practitioners and healthcare providers think they'll stay with us for a couple months, couple years. We have a chiropractor that we work with. They say PVA, patient visit average, is X. And we usually keep them for 12 months. What is this? Suddenly their back never hurts again? Suddenly they stop exercising and they never throw out their back. They never need to come back again? Of course not. That reactivation might be 3 years away. That reactivation is still very relevant. You can't go cold on a patient for 24 months and expect to be top of mind. They might think back about the time they spent with you, but it will take a lot. They'll need to be in quite a lot of pain to do that. They need to cross that threshold of, oh yeah, I need to start my care again. If there's a relationship that exists, you don't need to wait for that severity in the clinical pain to come back to clinic because it's easy. It's easy to say, hey, everything okay? Haven't seen you in a few months? Checking in on you. Oh yeah, actually I was just this and that and I have this problem and I was thinking actually I should come back. Yeah, I really appreciate the nudge. The number of patients who say that back to us, I really appreciate the nudge, is just shocking. What have they been receiving from practices up until that point in time? Snail mail? A letter in the post? So it is a time for your reminder for your, that is not activation of lifetime value. That is just, I'm following my process. I'm following my process.
Essentially describing passive patient management and active patient management. But the funny thing is most clinics or owners or operators think that they're actively managing, but there is level to that, right? In terms of from passive to active.
100%. So I think internally, at least at Coherent, we'll often talk about active patients under management. So active patients under management means how many patients are we currently actively engaging with that are communicating with us, even if what they're saying is, thanks for checking in, everything's fine. Trying to extend, build, develop that relationship to prevent revenue loss along the journey, but also to ensure continuity of care. That is active. Active means you are thinking ahead of where the patient journey is. You are trying to take an action in anticipation of a possible clinical need, not 3 months have passed. And so time is the measure of whether or not I should do something. In fact, it should be about the patient journey. What about the patient is telling us that there is now something that needs to happen? That's a very different approach than time as the measure of re-engagement, when in fact it should be patient as the measure of re-engagement.